It's such a pleasure and an honor to be here. My name's Ilona Torontali. I'm the Vice President of Pricing and Reimbursement at Roche in our global headquarters in Switzerland. So I'll make a few remarks. I first of all want to thank The Economist for including me in this distinguished panel. We're here today, of course, to talk about unlocking Greece's potential as a life science innovation hub. But our discussion today goes way beyond mere investments in a country's healthcare system to more fundamentally, how do we drive growth through the creation of active and healthy populations? It's really clear to me, and I think you've been hearing this in quite a few of the panel discussions over the course of this week, medical innovation is absolutely essential for healthy and productive societies. And there's an excellent McKinsey report that demonstrated that for every single dollar invested in healthcare, it's possible to achieve a $4 economic return, which is why we need to look at investment in health as an investment, not just a cost. And it's part of a sustainable future for any economy, including the economy of Greece. And the benefits of innovation also extend far beyond individual patient health. So if you look at pharmaceutical innovation, and I'm both a pharmacist, a former payer, as well as a pharmaceutical industry executive today, I would say when we look at population health benefits, contributions to morbidity and mortality, you can see that it's estimated that 35% of the increase in life expectancy between 1990 and 2015 has been generated through the innovation that's come from the life science sector. And this is really critically important. A Y4 study, we're partnering with Y4 at Roche, showed significant GDP contributions from our medicine. So it's not just about keeping people healthy, keeping people at work, and actively contributing to economic growth and societal well-being. I think it's really important as well to look at economic growth as created through investment in R&D. To invest in R&D, you need to keep pace with the standard of care, which means you need to have timely access to innovative and life-saving pharmaceuticals. And then you look at partnerships, public-private partnerships, and how critical they are. And I'm really proud of my Roche Greece colleagues. They've done some excellent work around improving patient experiences through patient support programs, which really looks at how to deliver improved care through pilots such as one conceived of and supported by Roche Hellas, designed by EY Greece, to really look at allowing at-home administration of treatment, moving people from high-cost in-hospital care to ambulatory care in the community where they have improved quality of life and good outcomes. I think the other thing that's really important, and it's been so phenomenal to hear about the investment strategies of Greece in life sciences and beyond. A company like Roche, and we're just one player in the industry, but we are a large multinational company, we invested 13 billion Swiss francs into R&D in 2024 alone. In Greece, 2,300 patients have been enrolled in Roche clinical trials between 2015 and 2025. And even today, we have 144 investigation centers participating in clinical research. So why is that important? Obviously, clinical research is just a part of this ecosystem conversation. What do we need? We're going to talk about this in the panel today. We need conditions that really support that ongoing investment, including readiness to adopt innovation. We need to have timely access to that innovation as well. And we need to look at removing barriers. What is keeping Greece maybe from being as competitive internationally as it needs to be? You've made significant improvements in your economic environment, but there's more that can be done. And just a few more things to say, I think, before I hand it back. Even though our industry contributes well beyond clinical trials, the current investment clawback mechanism, which the former panel or the previous panel spoke about as well, it has too narrow a scope. We can't see the recognition for eligible investments that really should be included in how we look at the contributions that the industry makes. So to unlock Greece's potential as an investment destination, we recommend a holistic approach to pharmaceutical policy. It must have an adequate and fairly allocated budget and create an environment that ultimately is conducive to investments. from local companies and also from international headquarters as well. You know, in closing, I would say prioritizing policies that foster that innovation, recognizing healthcare as an investment, encouraging ongoing sustainable investment from the life science sector really can build not only stronger economies, but healthier populations and a prosperous future.